Definitely. I think it's a medical emergency. In such a small hospitals, we have to bring oxygen from almost 50 to 60 kilometers away. In previous days, we have to refill oxygen cylinders thrice in a month. Almost uh, after 10 days, we used to refill. But right now, on daily basis, we are refilling. Then also, we don't know what is going to be demanded in next time or in next coming days. I think it won't be sufficient, this much oxygen. But this is the situation where we have to take care of ourselves too, our family too, and public or patient too. Because while treating, while serving, we are getting infected ourselves. In my family, I live with a wife and two children. I have got 4.5 years daughter and 3 years daughter. And my wife is a consultant gynecologist. So we both are serving for patients, for public, day by day. And we don't know how much we are carrying these viruses along with ourselves.